A couple weeks ago, I walked into a supplement store in Midtown New York and saw Korean ginseng extract sticks sitting right next to collagen powder and multivitamins. I had to laugh because in Korea, the same ginseng can live in two different worlds. One version is a supplement, something anyone can buy at a store. People purchase them along with the vibes: natural, holistic healing, wellness culture. The other version, the one I prescribe as a licensed Korean medicine doctor, is pharmaceutical grade. It's handled only by medical professionals and regulated like a prescription drug. Same herb, completely different system. But Korea didn't always have that separation. In fact, 30 years ago, Korea's herbal market looked a lot like America's does today. This is a story of how a series of public health crises forced Korea to transform herbs from unregulated folk remedies into trusted pharmaceutical materials, and why the US might be heading down the same path. Back in the 1980s and 90s, Korea's herbal landscape was blurry. People consumed herbs like food, like medicine, like tea. But the point is that they prepared themselves at home like a natural remedy. There was no unified quality control, no standardized testing for contaminants, only minimum government oversight. Markets sold dried herbs in bulk. Some people made remedies based on folk wisdom and became sick. Reports began appearing in Korean newspapers. Heavy metal contamination in popular herbal products, counterfeit herbs being sold as premium materials, cases of liver toxicity linked to contaminated formulas. And here's the crucial point. The problem wasn't that the herbs themselves were dangerous by nature. These were plants that had been used safely for centuries when used correctly. The problem was contamination, poor handling, fraudulent sourcing, and zero accountability in the import chain. In other words, it was a system problem. Korea was facing a trust crisis, and the government knew something had to change. In the early 2000s, Korea's Ministry of Health and Welfare and the Korea Food and Drug Administration made a decisive move. Herbal materials used in medical practice must be managed at pharmaceutical-grade levels. This wasn't just a policy tweak, it was a complete paradigm shift. They introduced a new legal concept: pharmaceutical-grade herbal medicine. Not general health food, not folk remedies, not supplements you pick up at a grocery store, although they were still available. The difference was that these materials had to meet the rigorous national standards such as pharmacopoeia specifications, testing protocols for identity verification, residual pesticide limits, heavy metal thresholds, microbial contamination screening. Only materials that passed these criteria could be legally recognized as medical use herbs and used in Korean medicine clinics. Now, here's an important clarification. Korea wasn't treating these herbs like new experimental drugs that needed clinical trials to prove safety and efficacy. Their therapeutic use was already validated through centuries of documented practice. What was new and dangerous were modern contamination risks, industrial pesticides, heavy metal pollution, fraudulent substitution, and unregulated international supply chains. The solution was to ensure what patients received was actually safe, pure, and correctly identified. The Korean government didn't just announce new standards and hope companies would comply. Over the next decades, they built the infrastructure to enforce them. Manufacturing facilities had to get certified. Clinics that prepared herbal formulas had to meet strict facility standards. And most importantly, every batch of medical-grade herbs now required testing through government-approved laboratories. Heavy metals, pesticides, identity verification, all documented before materials could be in use. Actually, Korea's commitment to herbal quality control had a precedent: Korean ginseng. By the 1980s, Korean ginseng had gained global fame for its quality, but success brought counterfeits. Inferior products were repackaged and sold as Korean ginseng, damaging Korea's reputation. So the Korean government did something bold. They created the Korea Ginseng Corporation, KGC, a state-backed brand. Only ginseng that passed the rigorous government testing could carry the seal of KGC. The government said, "We will stake our national reputation on this product's quality." It worked. KGC became globally trusted. You can find it everywhere from Incheon Airport to Amazon or Fifth Avenue, New York, local supplement store. This wasn't marketing magic. It was a systematic quality control backed by government accountability. And it proved what Korea would later apply to all medical grade herb. When the government takes responsibility for verification, consumer trust follows. Meanwhile, in the United States, herbal products exist in a fundamentally different system. Here, there's a law, Dietary Supplement Health and Education Act of 1994, that legally classifies herbs as foods, not drugs. What does that mean? Companies don't need to prove their products are safe or effective before they are sold. They don't need FDA approval to launch a new formula. The FDA's role is mostly post-market. They can inspect and recall products, but only after they are already on the shelves. Now, companies are required to follow CGMP standards, internal quality testing, contamination screening, documentation. But the critical difference? Compliance is self-managed. The FDA doesn't approve tests, doesn't verify every batch, doesn't pre-screen products. Companies police themselves. FDA enforcement happens only reactively. This is why quality varies so dramatically. Some companies maintain rigorous standards, others don't. The consequence? Product recalls, ongoing FDA import alerts for suppliers with contamination histories, independent testing, finding mislabeled products, wrong ingredients, or missing the herb entirely. The system depends on companies doing the right thing. Many do, but when they don't, consumers find out after the damage is done. So now, when you walk through a supplement store and see that same ginseng extract stick, you know, there can be more than just supplement-grade ginseng. In Korea, it took years of trial, failure, and public health scares to imagine a category for herbs that is beyond food and culture. America is still in its early chapter of that story. But every recall, every contamination report, every consumer who starts asking harder questions, that's how reform begins. Hopefully, someday you walk into a store and see an herbal label that says pharmaceutical grade. And it won't sound bizarre. It will just mean what it should have meant all along.